All right. Well, he might be a few more minutes behind, so we'll go ahead and get started here with the manual therapy topic. This is an extension of therapeutic interventions as the month of October. Basically breaking down all the different options. Last week we talked about modalities, so then we're continuing with manual therapy options here. This is going to be pretty encompassing, not necessarily exhaustive, but it'll include different things like instrument assisted soft tissue, cupping, things along those lines. Pretty much anything where the clinician is actually putting their hands on the patient to impose some kind of a therapeutic intervention. So, starting with the overview, these are the different kind of options that are available. So, massage and all of the different massage techniques that are available to the clinicians. Obviously, there's a lot that goes into that, and that's why there is a subspecialty of massage therapists. Then there is also the instrument assisted soft tissue mobilization, things like Graston, or what like the athletes typically will call scraping. There is stretching. So if the clinician is helping to facilitate the stretch and the athlete's not just stretching on their own. And then there's joint mobilizations or joint oscillations, things where you're actually trying to shift the bone structure around, changing the articular interface. So for the massage, as I said, there's a lot of different techniques within the massage field. And so the five basic techniques are effleurage, petrissage, friction, tapotement, and vibration. One second, let me let him in. And so then within there's the five basic techniques for any kind of a massage therapy, and you can implement them in different ways. There's different directions of application. There's different tissue depths that you can apply, and so they all have their pros and cons, advantages, disadvantages, but you can apply them in a different number of different ways to try to get the outcome that you desire. So whether that is to increase like muscle fascicle length, for example, or if you're trying to maybe just reduce pain, or if you're trying to do something like lymph drainage, you're going to change your technique a little bit. So depending on what your desired outcome is, you can change those different technical applications. Then there's the more specific that's loaded to like the tendon, for example, with cross friction massage. Trigger point release typically is more of a pain intervention where we're trying to reduce muscular pain with what's so-called the knot. I actually hate that terminology, but you're trying to find the painful point of the muscle tissue and you're trying to intervene to reduce that pain within the muscle. And then there's active releases, which is similar, but you're actually trying to facilitate muscle length and mobility. So you're actually trying to get the muscle moving. And so that you're going to have the athlete move their muscle or contract and relax as they're going through the treatment while you're pinning the muscle tissue to try to facilitate that increase in muscle length or mobility. And then lastly, like I said, the lymph drainage. So if you're doing any kind of edema reduction, swelling management kind of a treatment. So that'll be a little bit lighter, more superficial massage technique as opposed to the trigger point or active release. But you're trying to actually flush out and help the body's immune system to get rid of that swelling that might be present. Any comments, questions so far? Getting into the instrument assisted soft tissue mobilization. So there's some different options here, and they all, again, have pros and cons, advantages, disadvantages. So cupping, everybody's pretty familiar with. Those are the things that leave the giant octopus marks. But specifically within cupping, there's a few different variations that kind of change the perception or the experience for the athlete. So in the US, we almost exclusively do dry cupping. Wet cupping it takes cupping to an extreme. And so if you ever Google like nasty pictures of cupping, you'll see blood actually in the cups. The only time I've seen blood within a cup is if an athlete has like back knee and a zip pops inside the cup. But for the most part, we're not trying to create blood within our cupping intervention. We're trying to just treat either the pain or the adhesions, whatever our intention is there. And so we don't try to create these incisions like what they will do in more Eastern medicine, where they're actually creating some kind of a superficial either abrasion or incision, and then they're applying cups to it to actually intentionally draw out the blood. Fire cups, vacuum cups, silicone cups, those are all just different applications of the dry cupping, and so the amount of pressure that you can get within them, and they're coming out with different technologies that are going to be a little bit more modern than these typical approaches. Fire was the traditional with the glass cups. Vacuum was a upgrade, and it made it more accessible for everybody. And then now silicone is a portable option, and so you don't even have to worry about your cups breaking anymore. And then static versus dynamic, so you can have athletes move and actually mobilize the tissue while you're pinning, similar to like what you're doing with active release technique, but you're doing it more superficial on the skin and subcutaneous tissue. Getting into the scraping, so you've got a million different brands. Everybody's making their own device now for scraping techniques. So Graston was probably the OG, but then Hawk Grips, IASTM, Fat Tool all made their own variation of it, but they all pretty much do the same thing. They're going to argue that their tool specifically targets different tissues better or more precise. But in my experience, they're pretty much all the same, even the knockoff versions from Amazon or Walmart, whatever. Gua sha technique is very similar to scraping. The difference here is going to be in the material. And so actually, I correct myself, according to the traditional Graston treatment, the intention here is to actually, it's a full therapeutic intervention where you have not just the treatment, but also you have the stretching followed by the strengthening, followed by ice specifically. And so the true Graston technique is much more all-encompassing than just your typical scraping treatment. And so gua sha is scraping, but the intention here is actually circulation. And so we're trying to create these the differences in the skin where you're seeing these red marks. The term is escaping me for whatever reason right now. It starts with an E. Anybody know it off the top of your head? When you create these little micro bruises. You're on mute, Dave.
Are you talking about ecchymosis?
Yes. And so when you see these little red marks there, the old school way of thinking was that you have to actually create them in order to be an effective treatment. We now know that that's not necessarily true, but for gua sha specifically, it's used for circulatory conditions to promote new blood flow and heal the superficial tissues. The difference in material has pros and cons. It's a little bit softer, so you can use it around more sensitive areas like the hands, feet, or face. Things like buffalo horn and jade are going to have a smoother edge. It's a little bit more dull, whereas some of these metal tools are going to be a little bit more sharp. I've also found that the feedback to your hands as the clinician are a little bit less accurate with gua sha. So if you're using, I had a set of buffalo horn, and I don't really feel any kind of resonation when I'm applying it over the athlete's tissue. Whereas if you use a metal tool, you can feel those little vibrations, and you can kind of tell where you're getting resistance. So pros and cons there. Do you want to be a little bit more gentle with the athlete's skin, or do you want to dig in and kind of feel what you're working with? Massage gun, these are pretty much also a dime a dozen. They all do pretty much the exact same thing. Theragun, Hypervolt are the two big companies and probably the first ones that made it. And now everybody's making a Temu version of it. So they all do pretty much the same thing. There it is on display.
That's the Rally. I just got it today.
Who makes that?
Rally.
Okay.
So Rally is kind of like the thing, like in the basketball world, like Mr. Do It Moving put a big reel out about it. But the difference with Rally is it oscillates.
Mm-hmm.
So it's not percussion. And
right.
You know, I'm not going to leave hyper ice, but it's interesting. And the oscillation creates heat, you know, just from the action. And then so it's a little bit more sensitive than percussion. So I can see utility to it. But it's interesting. So it's got some things that they need to work on, like how to charge it, but it's interesting.
What's the battery life?
I don't know yet, but the problem is like, this is how you charge it. So right now, the only charger is like a large
There.
dock that you set it in.
Mm,
So they're working on like they're working on a travel version type of charge dock, but you still
mm,
have to set it. So I'm like, if somebody really travels with this, that makes it
right.
really complicated charging,
Yeah.
in an airport or whatever. I mean, if it's not USB-C these days, it's almost too frustrating.
Right. Right. Yeah. Especially for you guys when you're traveling,
Yeah.
what, once a season, right? You
Yeah.
only make one
Yeah.
trip. Yeah. As much as you guys travel, I mean, even like football, traveling once a week, that's probably annoying for them. So with basketball, you guys are on the road a lot more.
Yeah.
That's probably not ideal for you guys, but they'll probably make a fix to that pretty quickly, I would imagine.
It's going to be small, but I still think there's probably a way they should do it. But I've messed around with it just a little bit. I kind of
Mhm.
like it, but
Mhm.
I'm not going to be putting out any content about it though, just because I don't want to damage any relationship with um, Hyper Ice. But it's
Mhm.
interesting.
Yeah, yeah. I'd be curious to see if that takes off. I mean, even like the Venom, right? Like the Hyper Ice, they've kind of pigeonholed or cornered the market in terms of that kind of stuff with the heat plus the vibration, and you've got
Yep.
all these different. Even now, like the shoes, the Nike collab that they put out, and the so you get the heat plus the vibration plus it's on their shoes. And you can walk around in them. So there's tons of stuff that's coming out. This is obviously a very popular segment of the therapeutic interventions world. So I would expect here in the next probably 5 to 10 years, they're going to continue to expand this practice.
Yeah, I think so.
That takes me to stretching. So there's a whole range within stretching, but specifically for manual, because it has to be hands on by definition, it excludes things like active stretching. So if the athlete's just going through any kind of active or activation where they're just doing the stretching on their own, that wouldn't necessarily qualify. But if you are assisting them in stretching, so if they're trying to stretch on their own, but then you're applying a little bit of overpressure, then active assisted falls into that manual category, as does the passive. So if the athlete's just laying there and you're trying to apply a passive stretch, then that would qualify as manual therapy. Ballistic stretching is, for whatever reason, frowned upon. I think the original sentiment was that you can actually hurt somebody by doing ballistic stretching. This falls well within our scope of practice, and we'll get into it on the manual or the mobilizations slide. But the oscillations that you're doing in a ballistic stretch are so well within the tissue capacity that you're never going to hurt somebody. I've never heard of anybody getting injured by doing ballistic stretching unless you're working. I mean, especially if you're with athletes, but unless you're working with like a 95-year-old person who's like thin and brittle, like you're not going to hurt their muscle by rocking in a rhythmic fashion. So ballistic, I will use a lot of times if I'm trying to get them to relax a little bit, shake it out a little bit when they're either at end range or just before it. And then when they relax, then you can push that tissue a little bit further. The two important variables here for me are going to be magnitude and duration. So the intensity of the stretch. And most athletes don't stretch hard enough, nor do they stretch long enough. So most athletes, if you tell them to stretch on their own, they're going to go out and do maybe 10 to 20 seconds of a light stretch. They're just going to feel it a little bit and then they're going to back off. If you're trying to actually create muscle like architectural changes, then you need to go intense to the point of discomfort or pain, and you need to hold it for a duration that induces that same kind of discomfort or pain sensation. Any comments, questions about that? So this is the joint mobilization slide that I was referring to. The only one that's not in our scope of practice is grade 5. And this depends even on your state regulations. So for most athletic trainers, you can do grades 1 through 4 safely and confidently because you're not going to cause any kind of injury. Grade 5, with the intensity of the actual manipulation and the velocity of it, taking the tissue beyond its end range, you could potentially cause injury. It's unlikely even then, but you could. And for that reason, it's a protected practice. Physical therapists a lot of times can, but athletic trainers for whatever reason are not allowed. We're not invited to the party. So going through the grades, so there's the small oscillations at the beginning range. So just basically you're just shaking them out. You're just getting them kind of to relax and loosen up. And most of the time, this is just going to be a pain modulation treatment. You're not actually trying to change the tissue capacity. You're not trying to increase range of motion or anything. Grade 2 is a slight progression of this. You're going to the end range, but you're not going past it. You're just getting them right up into that end range point. So you're taking a little bit larger oscillation. And then grade 3 is you're actually holding at the end range, and you're going to go through the oscillations while you're at the end range. And then grade 4 is you take them actually a little bit past their end range, and you're kind of inducing that stretch sensation for them. And then, like I said, grade 5 is the manipulation. This is all the chiropractors that all those memes that come out about, oh, just hold still real quick. Those are all the high velocity thrusts that are beyond our scope of practice. For the literature review for this week, I've taken a ton of my manual practices from the book Anatomy Trains. Obviously, this is more of an anatomical / fascial discussion textbook, but the book itself talks about it a little bit in terms of massage techniques and release techniques, different directional applications for different muscle, different anatomy that you're working on. But then also there's the digital version has video demonstration of how he actually suggests to release towards certain structures. So one of the things that stuck out to me was in the calf and the back of the knee. So essentially you have your gastroc that comes up and over, and then you've got your hamstring that tucks down and around. And so basically they're just holding each other, kind of like if your hands were holding your wrist. They wrap around each other for security, and they interlock and they interweave so that they function together. So if you're trying to promote relaxation or give a little bit of slack to the hamstrings, you can massage the gastroc proximally. So you start distal and then you work your way proximally. Similarly, if you're trying to massage the hamstrings to produce slack to the gastroc, then you're actually going to go start proximal and work your way distal. And because they have that kind of a knot relationship, then you're actually going to pull the knot in one direction or the other based on your directional application of the massage technique. So the textbook, but then also the digital version of Anatomy Trains is really good for manual therapy. Obviously, I don't agree with all of the fascia claims and how we can specifically isolate and target fascia. I think that is pretty much nonsense, but the book itself in terms of manual therapy is pretty good. Physiopedia has a blog post called Manual Therapy, which is pretty all-encompassing, talks about massage, talks about instrument assisted, talks about cupping, talks about joint mobilizations, and it has citations for a lot of them. So this is a pretty dense publication or passage, but the info in it is really good. And then the last one I have up here is NIH. There's an article titled Pain Relief by Touch, talking about how the importance of manual therapy and how we can relieve pain and the pathways, specifically how we are actually implementing these changes, even just by touching. And so we put our hands on our patients and all of a sudden their pain decreases. What is actually creating that change? Because it's not even necessarily massage or stretching or anything else. Just by having a therapeutic touch, it reduces their pain. So it's an important article to understand when we're talking about how we actually induce these changes. For the media side of things, talks at Google, they actually brought on Tom Meyer. So he talks about his book Anatomy Trains, and you can kind of gather a little bit from that. It's only 40 minutes as opposed to, I think the textbook has roughly 2 hours worth of content in it. But it's a really good introductory talk if you're interested in learning more about Anatomy Trains. Physio Tutors, they have a YouTube video talking about the Maitland mobilization grades. And then also on their website, they break down the different classifications or schools of thought for manual therapy. And then also they have an interview or they had a podcast episode with Chad Cook discussing manual therapy and why people think it's like voodoo and they have such disregard for it. And this is basically a summary, so it's only 7 minutes. They just talk about kind of what the podcast encompasses. But then if you want to see the full episode, that's actually in the YouTube description. Comments, questions about anything so far? Anything before we move on?
I don't know if you guys, I have a coworker that does it. Myofascial release, and it's kind of like it. Honestly, when you see it at first, it looks like you're doing an exorcism type of deal. But basically, and I have videos, and I can show you guys because she's done it on me. But basically, she puts her hands on you, like not even applying that much pressure, and your body goes into an like involuntary unwinding type of deal. I don't know if you guys have seen that or experienced it.
I can't say that I have based on what you're describing. I'm sure Dave's been around longer. He might have seen that. It sounds a bit to me like what's the name of it? I think it's like PRP, where it's like the receptive. Oh, I can't remember what it stands for. But basically, you're like rubbing or like irritating like the neural pathway to then try to activate certain muscles. There's some track coaches who are really big on that. It was big for a little while back in like the late 2010s, early 2020, maybe.
Yeah,
Dave,
like
what do you think?
RPR from Cal.
Yeah, RPR. That's what it was. That's what it's called. That's kind of what it sounds like to me. I don't know if you heard what she was describing or if you've seen anything like it.
Just a little bit. I think it depends. Like it's weird. Is like sometimes depending on the manual release that you're trying to work on, how they respond is can be unique, but it's also like athlete specific. Like I've been really diving into like that lateral gutter area of the quad. And I've really seen a lot of positive results for people with like patellofemoral issues. And sometimes they almost spaz out because they don't ever deal with that. They don't stretch it. It's hard to isolate that kind of stretch. They don't roll it because that part hurts. So they naturally avoid it. So that's just all the more, it just builds up. It's like sometimes, yeah, it does kind of spaz out and they kind of freak out. And then as far as like the athlete response part, I mean, that's just so dependent as, are they experiencing it or are they just freaking out because it's uncomfortable? So with not being there, it's hard to weigh in too much. But I have some guys that can really tolerate it for me in some of those sort of more intense things, and then some can't. And then I adjust based on who.
Have you found that like that area, obviously manual, you have to compress a lot of tissue to get down into some of those deeper layers of tissue, and especially your guys are going to have a ton of quad mass. Have
You'd
you
be
found
surprised. Not as much, at least not with my roster right now.
skinny but quick movers and strong
Yeah, a lot
guys?
of like we call them twitchy or
Yeah,
the
yeah.
freakier, the tweakier.
Okay. Have you found, I guess, in maybe in your experience with like football, that in order to get down into those deeper layers, maybe it's more advantageous to use something either like a massage gun or to use maybe dry needling as opposed to doing manual where you're digging down in there with your hands?
I do a lot of both. But then I think, the bigger they are, that's where you probably get into like tempering. I think that makes a big difference if you can get a guy that can tolerate, 80 pounds or 100-pound tempering roller to really just slowly roll that area, but it works. But no one's thumbs are going to last that long or depress that deep. But or those 25 plus pound pills, big time, really big time. But I try to do, there's a combination of manual dry needling and, massage gun, or we'll see the rally or whatever. And to like combine it all. Cause like, you know, the goal is kind of like you talked about Graston, is the goal is not Graston. The goal is like movement and preparation. So you do a little bit of each to really kind of get them moving. So most of all that stuff for me is like preparatory, you know. So I do
Yeah.
a lot of combo, and kind of like some of my posts have been these last few weeks is I try to maximize the minimal, as in like I have a minimal amount of time, so I try to maximize what I can do during it.
Yeah,
You know,
I've
try to put that
liked
on
those
a
posts that
t-shirt.
you've been putting out, with the things like red light, where it's like, yeah, maybe it only gives you a little bit, maybe it's a marginable gain, but if they're already on the table anyway, what does it hurt to throw on a red light while you're doing either dry needling or while you're doing massage, things like that? If you're already going to do those treatments on the table, it's not hurting anything by throwing on red light.
You know, that's what I think. But then also, you know, if there's any truth to this, to their science, that it somehow can increase mitochondrial production, then great. And then at the same time, is like, it's why I've been dabbling in PEMF. Is like there's research out there to say that PEMF works. So once again, you know, it's a passive treatment. So if they're already doing something else, I'm going to send them through some cycles on that. Cause like, if I can get it, if it helps at all, great. You know, there's no negative. And if it doesn't help that much, like maybe the device I have isn't that strong. Well, so what? You know, they're still, if they're getting anything, that's great.
Plus, there's the obviously the perception, right? Like they're seeing these lights or the different gadgets that we're applying it, and so then in their mind they have buy-in, and then that's half the battle is getting them to kind of think about what these effects are happening, and then whether or not they're actually happening, their brain is telling them that it did.
I agree. You know, I was reading an article the other day and it talked about something like even as simple as complaining, and the negative energy created from complaining can almost set a like a traumatic response to you internally, and that negativity almost like has a negative effect on your memory and various other things that kind of might coincide with what somebody might experience with certain levels of trauma. So it's interesting. So if that kind of energy, if these kinds of things have this huge neurological, physiological effects on you, psychological, then, you know, what's to say these other things wouldn't work? Like I was reading another thing about the different types of shock waves. So we have a focus shock wave. We have the stores shock wave, and it is like the electromagnetic type of shock wave versus like a piezo wave or the some of the other type, the radial. I love it, but it's electromagnetic. So technically it's a delivery system of something, but I mean, still it's electromagnetic like the PIMP. So I think that there's, you know, just more things emerging to say that this might help, but we're just going to be a while from now before we really truly see the results. Cause like, how do you quantify it besides, you know, just, do you feel better or not?
Yeah, we were talking about that a lot last week with the modalities, and
Yeah, I'm sorry I missed that one. I was looking.
No, you're good. The other one was the WinBack, the
Yep.
TechR. I think that one's another one that's I've seen a lot of companies that are coming out with that technology as well.
Yeah, I think there's a lot to that. Just like, I mean, you know, with modalities, how much money do you have? How much time do you have? How many people do you have? So that obviously makes a difference. And then you don't want to just jump on the first bandwagon. So I think in some of these regards, it's okay not to be first, because you would at least like it to you know, see that it truly works. The science backs it, because of course their research says it works, you know. But so I think it's okay not to be first. And then in some instances it is. It just really depends on what it is and then what's your investment to it. But like I saw a fancy oxygen tank that you would go sit in, and I'm like, those are fantastic and all, but like it's just not feasible. It's not, you know, there's just so many other things that we could all choose to make our lives easier versus that, you know. So
Yeah, it's interesting. That's definitely a very American approach to medicine, where it's like, what is the newest technology? Because obviously technology is advanced, so therefore the science will follow. But in reality, like you look at some of these things like cupping, and it's been around in Eastern medicine, and it's things that a lot of American medical model or Western medicine more broadly will kind of look down upon and say, oh, there's no evidence for this, or it's just placebo, whatever. But like, it's been around for thousands of years for a reason. Like, there's definitely some kind of a positive effect, and whether that's psychological, like you were saying, where it's just placebo, or maybe it's physiological and we just don't understand the mechanisms yet, there's definitely something to it. And so if we can use these different manual therapy combined with modalities to get our athletes moving, and then once they start moving, obviously the movement is the medicine.
yeah, I agree with you. And I think, it's still unique because we're all in an arms race. So, depending on the setting that we work in, high school might be a little bit different. Semi-pro might be different because of the level of support that they get. Professional sports like you're in, or collegiate sports, depending on the sport. It's, like I had a recruit 2 weeks ago where their parents asked me about every single modality we had, in-depth questions. And I really had to be on it, and we really want this
Mhm.
kid. So
Yeah,
it's like they're paying attention to those things. And
yeah,
and
for
when
sure.
I went into depth, that's what they wanted. So I didn't hold back. And I'm not a big believer in dumbing things down.
Hmm.
And I think that helped them. They want to know. They want to know when you use it, why you use it, things like that.
Hmm.
And that's just kind of how it is. But we're all competing with uh, a greater knowledge base from them because they can
Hmm.
see it on Instagram or social
Yeah.
media, and they have friends that are, going to, major prep schools or major like agencies that have their own physios or athletic trainers or physical therapists, and they have these win backs and newbies and indibas and
Hmm.
you name it. So their aptitude is so much higher that we kind of have to compete a little bit. So the way I describe it now is when I go around my room, as I say, and some of it's a little bit tongue in cheek, but I say I curated everything that I have. It's like not only do we have it, but I chose that instead of something else.
Hmm.
Or it's the same concept as what I take on the road. I was like, my road kit or my road equipment is my loadout.
Hmm.
I go based on the mission. Is it a one game? Is it a multiple game? How long is my injury report? What sort of things are guys needing right now that I need to try to facilitate on the road to some extent. So it's just a new world that we're living in. And it's no longer like do it because I said so. It's not stem and ice or heat and ice or walk it off. It's just way different. And
Hmm.
um it's really forced me, which I enjoy, but it's forced me to dive a lot deeper than I used to, as it relates to the type of therapy I prescribe, or how hands-on I am, or how I communicate. And I'm sorry, I always seem to hijack your calls, but
No, no problem at all.
it's
I,
it's way more complex.
mhm. No, I definitely appreciate you sharing your insight. And obviously, you've seen the game change because you've been in it for so long. So I think that kind of detail and kind of the non-textbook information is super helpful to anybody that's going to watch this. They're going to hear your experience, seeing the things change, and maybe they won't appreciate it because they're coming into this world. Sally and I were just talking about how much the game has changed with the implementation of the transfer portal and all the different nuances that
Yeah.
that brings, where these athletes can just literally just pack up and leave whenever they want. And I'm sure there's a big influence on their decision to sign, is how well, and especially longevity has been very popular in basketball lately, partially because of LeBron and all the media that follows how much he's spending on taking care of his body. But I'm sure that's a big selling point to these athletes, especially if they think they have an NBA career in them. What is this college stop going to do for my NBA career? How are you going to take care of my body to make sure that I get there? So I'm sure that's a big point for your guys.
You're absolutely right. And now it's like, you used to look at guys in the form of development. This in football was more so because they always have had to stay until they were a junior and then they could go pro and things like that. But now with the transfer portal, every single year is a franchise, not a franchise. Every single year is a free agency. So for us, it's like we have to shift our mindset on what we can do, and we cannot develop them anymore. So it's like, how do we fast forward it? How do we maximize it? And then what do we let go of? I do all our force play testing. I do all of our analytics and on our data collection. And it's like, there's going to be asymmetries we're not going to fix. You're not going to do it in 8 months. What are you okay with? And then it's like, how do you get the most bang for your buck? So like, that's where I went right away, is like, I look to attack it on every front is, emphasis to strength and conditioning. Okay, we need to place that. It's tough though with the way we go, because we play so much, and we played this summer to where we lost a lot of a valuable window. And then how do we recover? Everything is on fast pace. We got to recover. So I've scoured America and Europe to try to see what things are we allowed to do to improve their recovery outside of what we already do. If it just agrees with what we're already doing, then great. Then it just reinforces it. But that's where it's like, okay, what are things that we can control? Well, all right, supplementation. Okay, guys, we can't give you creatine, but you can take it. It's safe. It's researched. You're going to benefit. You're not going to get too big. You need to do it. You need the energy. You need the cognitive function, all the things that it professes to do. You can afford it. And then it's like recovery, hot tubs, cold tubs, active recovery, massage, stretch, strength, whatever. That's why I really dove into hydro. I'm a big believer in BFR in general. We own practically almost every type of BFR there is. But I find that I use the Owens the most for intense training and intense passive recovery. But then outside of that, I really have moved to the hydro instead of, and I'm not knocking Suji or Airband, which we both have, but the hydro allows them to do something untethered. The level of occlusion, even at its max, is not dangerous. So they don't necessarily have to be monitored the same. And I think we might have even talked about this a while back. But then there's also the aspect of the things that it can do that you can't do with most other things, even if they're Bluetooth, is that you're going to get it. You could get in a sauna, and then you could go through a recovery cycle in a sauna. You jump around on a bike flush. You do a bike flush. You can wear them in the airport. You can wear them on the plane. And then what I've really gotten heavy into is they can wear them in the tubs. And that's really, really benefited us as we've navigated this summer, to where, we had 20 plus practices before our games in Germany. And then we played 7 games in Germany in less than 10 days, roughly. It's a lot. So, and with relatively 15 brand new guys. So it's not like guys that have a training age that's all the same, or even a training age for us that's the same. So 14 guys from 14 different places with 14 different levels of training age and 15 different sets of issues. So that's where it's been kind of tough. And I'm not one for hacks or cheat codes or whatever, but I've really had to dive in on what sort of things I can do and what can I control. Firefly, I mean, simplistic, it works. So I've really gone deeper into those things, because with everything that I learned, that's kind of where I keep coming back to. Traveling internationally, you get to know some of the international physios, and they try to siphon off them. And so one of the ones I've really kept in touch with quite a bit, he's treating a guy on the bench. He throws on one of the nice recovery systems, their game ready version. I'm like, perfect. I mean, it just shows that globally it's a lot smaller than we think. There's a company out of Germany that I'm trying to kind of maybe do a deal with, is Black Roll. black roll, really, really similar to hyper ice in a lot of different ways. A little bit cheaper, but predominantly in Europe and in Germany specifically. But they even sell like a lounger to where it's like a air mattress. It has a self-inflator, self-deflator, but it gets about human size, not like a mattress though. It's got contours that are perfect to inflate it, lay on it, do your recovery boots, and then deflate it, throw it in your trunk because it folds up. So a great road item, not expensive. It's like 199 euros. But we don't have that over here. Nobody does. The closest thing is that Nubis or whatever that brand where they inflate theirs, but that's like $3,000. So it's interesting to see kind of what and how things are done.
Yeah, you've definitely done and seen a lot, so it's cool to hear all your kind of trials and errors and what you've taken away from it, especially with the international stuff. Sally, any comments, questions that you want to follow up with based on any of that stuff or any of the manual stuff? All right. So I'm going to copy and paste that chunk of stuff out and put it in last week's modalities study group. But anyway, moving on with the manual for the publication review. So this week's paper was on muscle architecture adaptations to static stretching. And so a lot of people frown upon static stretching, and they'll say active stretching or dynamic movement is a lot better. In reality, there's pros and cons, just like most things. So this was a systematic review and a subsequent meta-analysis, which ultimately boiled down, I think it was like 500 studies, and came up with a total of 19 that qualified for their inclusion criteria. This was a total of 467 participants. And what they were looking at was the effects of static stretching on fascicle length, pennation angle, muscle thickness, and cross-sectional area. So all of the different architectural changes that are being produced by static stretching as opposed to more dynamic stretching. What they found was as a whole, stretching does increase fascicle length. It does not seem to increase pennation angle, and it does not seem to increase muscle thickness. However, when you break these papers down into subgroups, you actually see that the groups that have a high stretch volume increases the fascicle length more. And so there's larger effect sizes if you're actually increasing the stretch volume, the duration, and the frequency, as well as if you increase the intensity. And so this is what I was referring back on the stretching slide. When you're doing your passive stretching, are you holding this for a long enough duration, and are you pushing them to a high enough intensity of a stretch? Because most of us probably hold the stretch for 10 to 20 seconds, and we're probably saying, is that comfortable or is that too much? Do I need to back off? In reality, you probably need to push them to the point where they say, hey, you need to back off, and then you hold it there for like a minute to 90 seconds. Or even up to 2 minutes, and then you're going to get your true adaptation. So if you're trying to facilitate these structural changes, it has to be painful or uncomfortable, and it has to be long duration. The implications: if the goal is to increase the fascicle length, you need a greater than 5,400 seconds. So they took the median of all of these different papers, and what they saw was 5,400 seconds is the median. And so you're either going to be over that or under that. And then they divided them into low volume and high volume stretch groups. So you need a minimum of 90 minutes per week in order to facilitate these structural changes. And what that equates to was about 1:45 per bout. And you're looking at doing those, I believe it was 6 times a week. And so then over the course of 6 weeks is where you start to see those long-term changes. Sorry, I think the 90 minutes should say over the course of your total stretch program, which is 1:45 per bout, 6 times per week. And that equates to, I think, something like 12 minutes over 6 to 10 weeks is where you see the 90 minutes to facilitate the change. the intensity should be the maximum tolerable, or some of them were defining the criteria as the point of discomfort, so they don't stop until they reach discomfort. And then the last one, they were actually trying to onset pain. They pushed to the point of pain, and then they said, okay, now that it's painful, how far can we push you past that? And so again, just to reiterate, the duration needs to be long and the intensity needs to be high. And most of us aren't doing that either actively or passively. So when we're doing our manual therapy, think about that. Are you just trying to reduce pain, or are you trying to actually induce an architectural change? And for a lot of us, if we're trying to lengthen the muscle to increase mobility, then we really need to hold these stretches a lot longer. So just something to kind of think about with our practice. Any comments, questions about the paper? Good to go? Cool. That will wrap us up. So just to kind of go back through everything. So there's 4 different categories of soft tissue treatments or manual therapies. And so the massage, which includes a lot of different variations. There's the instrument assisted soft tissue mobilization, which also includes a lot of variations. There's stretching, which by nature of manual therapy is either active assisted or passive. But it's something where the clinician is actually using their hands to facilitate the stretch. Specifically, you should be pushing them for longer durations and higher intensities. And then for the joint mobilizations, we have access as athletic trainers to the first 4 grades, but we're not usually allowed to facilitate the 5th degree, which would be a manipulation, not a mobilization. Any last comments before we wrap up?
Thank you for being here. Thank you for doing this stuff, man. It's always great.
Yeah, I love it. Keeps me sharp, lets me review the literature, and then also share any kind of education or experience between anybody who's willing to listen and share. So thank you both for being here and contributing. And next week, or actually later this week, I'm going to try to do a double this week on Friday, talking about cryotherapy and thermotherapy. And I will rant all day long about cryotherapy and ice. There are so many people that are anti-ice, and I will gladly rant to anybody who is there. If not, I'll just yell at my computer screen. But that is it for tonight. So thank you again for being here, and take care. Enjoy the rest of your week.